Welcome everyone to the North Central Education Service District Regional School Nurse Update for the month of November. We're really glad that you could all join us today. And for all of our guests from around the state, welcome. And we're so glad you could be with us this morning as well. I am sharing the meeting agenda really quick. I'm Lena Kate I'm the school nurse team leader in the North Central Education Service District. For those of you who don't know me, and I am going to be the MC for today's meeting. Shortly here, we're going to be starting with Dr. McCleary from Confluence Health, who will be talking to us today about adrenal insufficiency and supporting our students who have adrenal insufficiency and helping them through their school day and helping them to be healthy and safe while they are with us. Then after Dr. McCleary at 10 o'clock, we will have Kristen Hosey from the Chelan Douglas Health District will be giving us a public health update for our region. And then after that, we'll be hearing from Blanca Salgado, our school nurse corps administrator for NCESD, will be giving us updates on regional and state school nursing initiatives and things that are happening around us and that affect us while we are taking care of our students. So as always, during these meetings, I want you to be aware that our meeting objective is to keep updated on information regarding resources, practices, and opportunities for us to be able to safeguard our students and help them maintain their health. Our meeting goals are to identify 2 of these practices or resources that we can incorporate into our work. And as always, we strive to follow the framework for school nursing. Just some reminders for this meeting. It is being recorded, so please keep your microphones muted. And we want to see your faces, so please turn on your cameras so that we're not just looking into the void, but we want to be able to enjoy our company with you today. If you have any questions, please raise your hand or feel free to put any comments in the chat. And Blanca and Sheila Salmon and I will be monitoring the chat so we can make sure your questions get read out. If you are wanting to get clock hours for this Zoom today, we do offer that in our region as a bundle. But if you have any questions about clock hours and want to pursue that, please email me after the meeting. All right, I am going to stop sharing my screen and introduce you to Dr. McCleary. Oh, wait, I'm sorry, Dr. McCleary. Before we do this, I kind of have a burning question for everyone. So what I would like everyone to do in the chat, if you could open that up for me, please. I would like everyone that is here, please put in an emoji of what you are most looking forward to this coming holiday season. On your mark, get set, go. And you can join along with us, Dr. McCleary, if you'd like to. All right. So Tasha Clark from Port Angeles are you looking forward to decorating the tree or the season? Help me understand that one. Go ahead and unmute and tell us about your tree. Okay. All right, so we've got a snowman and we've got turkey and family, lots of family, and skiing. Yeah. Nice. All right, family, sleeping. I love it. Absolutely. Sometimes we really need those times off to recharge and be able to take good care of our students. Awesome. Thank you. Thank you everyone for putting those emojis in there and helping us remember some of the fun things that are come ahead. All right. And Annie,
Lena,
oh, hi, Annie, you're here, and we're looking forward to books too. Awesome.
Lena,
Yes.
I can't remember. Does Dr. McCleary want questions during the presentation or afterwards?
I, correct me if I'm wrong, but I thought you said that we could interrupt you if we have questions. Okay. All right. Perfect.
Absolutely. Feel free to interrupt me. Lena, I'll just ask for your help to kind of monitor the chat. Feel free to raise your
Absolutely.
hand and I'll try to integrate those questions as we have them. But I should have some time at the end to address any questions
Fabulous.
that are lingering after the presentation.
Perfect. Okay. Well, while everyone is still filling in what they are looking forward to, I'm going to go ahead and introduce you to Dr. McCleary. So, Ellen McCleary is a pediatric hospitalist at Confluence Health Central Campus in Wenatchee, Washington. She is also the medical director of the Inpatient Pediatric Service and Pediatric Infusion. Sorry, I'm getting ahead of myself. Pediatric Infusion Center at Central Campus. She obtained her master's in public health from Oregon Health and Science University and worked in local and state health departments and at the VA prior to obtaining her medical degree. She completed her pediatric residency at University of California, Davis Children's Hospital before returning to the Pacific Northwest and settling in North Central Washington with her husband and two children. So, all right. With that, will turn the time over to Dr. McCleary.
Hi, everyone. Thank you so much for inviting me to speak to your group. I am going to go ahead and, oh yeah, go Aggies, go Davis. I'm going to go ahead and share my slides. So bear with me 1 second here. All right. Excellent. Can everyone see my slides? Thumbs up. Okay, great. So I'm really excited to talk about this topic and how to keep these children with this condition safe and supported in our schools. So I don't have any financial disclosures to make, but I will say that I'm not a pediatric endocrinologist, nor am I involved with any training guidelines that may be developed or forthcoming from the Department of Health. I'm speaking to you all in my capacity as a pediatric hospitalist who has experience treating children with adrenal insufficiency and hope to help us all feel more comfortable keeping these children safe in school. So my hope is that by the end of this presentation, we will be able to describe the new provisions for students with adrenal insufficiency laid out in some recent legislation, describe the basic physiology, signs and symptoms, and management of adrenal insufficiency, understand how adrenal insufficiency may impact a student's day, and what emergency medication and management plans and other accommodations might be necessary, how to identify an adrenal crisis in these students, and finally, how to treat an adrenal crisis with intramuscular steroids. And I'll just say really quickly, I'm getting over a cold, so I might have to mute myself to cough or take a little sip of water, so my apologies. I'm sure many of you are in the same boat. So there was some recent legislation passed in April of 2025. I'm sure most, if not all of you, are familiar with this. It's effective as of the 2025-26 school year, and it pertains to individual health plans for students with adrenal insufficiency, which I'll also be calling AI throughout this presentation, and who may give them emergency medication. So this legislation directs school districts to provide individual health plans for students with adrenal insufficiency, and it directs the school districts to adopt and periodically revise these policies governing the care of students with AI, including the acquisition of parent requests and instructions, acquisition of physician orders for monitoring and treatment for AI, the provision for storage of equipment and medications provided by parents, establishment of necessary exceptions and accommodations outlined in the individual health plans, the development of emergency care plans, and then the distribution of these plans to appropriate staff. And then if schools do not have a nurse on campus every day, it does allow parents to designate a parent-designated adult to administer emergency injectable medications. And these PDAs are authorized by the parents to perform the procedures outlined in a child's individual health plan. They must complete training on proper procedures and treatment, and this training is selected by the child's parent. This training may be provided by an organization that offers training for staff caring for students with AI, or an organization that offers training for caretakers of children with AI. And we'll go over some of those resources in my presentation today. Just of note, PDAs are not nurses, and they do not work under a nurse's license, and they must file a letter of intent stating their willingness to be a PDA. So if we are tasked with caring for these students with AI while at school, sorry, I'm just going to make one little change here. Okay. We must understand what adrenal insufficiency is. So we have two adrenal glands. They're situated on top of the kidneys, as we can see in this picture here. The adrenal glands make two types of hormones, glucocorticoids and mineralocorticoids. Glucocorticoids affect inflammation in the body, as well as our immune system and blood pressure modulation. The most important of these hormones that we're going to be talking about today is cortisol. And then mineralocorticoids, such as aldosterone, help control the amount of electrolytes and fluid in the body. So in adrenal insufficiency, the body does not make enough of these hormones. And this can be caused by a wide variety of disorders, which we'll chat about. But you can imagine that when we aren't able to modulate our blood pressure or our immune system, or regulate how our body is using glucose or sugar, or we aren't able to modulate electrolytes in our body or fluid levels in our body, a lot of bad things can happen. So adrenal insufficiency can be primary or secondary, and this simply describes where in the body the defect occurs. So we have a little depiction here of hormones coming from a few different glands in the brain, the hypothalamus and the anterior pituitary gland. And these hormones, in turn, stimulate the adrenal gland to release those hormones that we already talked about. In primary adrenal insufficiency, the adrenal glands themselves do not make enough hormones. And so that leads to a decrease in glucocorticoids and mineralocorticoids. Primary adrenal insufficiency can be caused by a variety of disorders, including steroid synthesis disorders, so impaired synthesis of cortisol or aldosterone or both. This includes congenital adrenal hyperplasia. This is the most common cause of primary AI in children. This occurs in approximately 1 in 14,000 live births. So I'm sure some of you will have some of these children with congenital adrenal hyperplasia in your care. It can also be caused by adrenal damage from infection, drugs or medications, and autoimmunity, such as Addison disease. And that's the most common cause of primary AI in adults, but it is a more rare cause of primary AI in children. Paroxysmal disorders, which leads to an accumulation of abnormal fats in the adrenal glands, genetic causes, which are more rare, inherited unresponsiveness to hormones secreted by the brain, such as ACTH, and then medications that can cause adrenal dysfunction, including high-dose ketoconazole, which is an antifungal medication. So central AI cause occurs when the brain does not make enough of the hormones that then stimulate the adrenal gland to make their steroids. And so I don't want you to worry too much about the names of these hormones, but just know that it happens further upstream from the adrenal gland. So this can be a defect in the hypothalamus or in the anterior pituitary gland. And it can be helpful, and sorry, just a note, this leads to a decrease in glucocorticoids only, not mineralocorticoids. It can be helpful to think of the causes of central AI as either transient, meaning that it will eventually resolve, or permanent, meaning that this child will have this condition throughout the rest of their life. So transient causes of central AI include exogenous steroids. This is the most common cause of central AI in children. So this is transient, and that signaling pathway will reset itself eventually once the child is done with an appropriate wean of steroids. An example of this is a child with leukemia who perhaps stops steroids and then has this transient adrenal insufficiency. Cushing disease is also in this category. This happens when a patient has a tumor that secretes hormones. When this tumor is removed, the child can then have transient adrenal insufficiency. Other medications, aside from glucocorticoids, such as antipsychotics, antidepressants, or opioids that can cause central AI. Anorexia nervosa, so there's some degree of signaling dysfunction that's present in these patients. True central AI is rare, but it can happen. And then critical illness. Permanent causes of central AI, so congenital, meaning these patients were born with these conditions, include optic nerve hypoplasia. This is really just associated with structural defects in the brain that cause multiple hormone abnormalities, especially growth hormone. And 1/3 of these patients can also have central AI. Prader-Willi syndrome, again, with multiple hormone abnormalities, a minority of these patients can have associated adrenal insufficiency. ROHAD syndrome, this stands for rapid onset obesity, hypothalamic dysfunction, hypoventilation, and autonomic dysfunction. This results, again, in multiple hormone abnormalities, including AI in 1/3 of these patients, and then genetic causes, which are more uncommon. Acquired permanent central AI really are permanent damage to those structures in the brain. This can happen from a brain lesion or a brain tumor, either brain trauma, surgery, radiation that causes dysfunction to these glands. Can also happen from iron overload from chronic transfusions, which leads to infiltration of the glands in the brain. And then other causes of infiltration, so permanent damage to those structures in the brain, such as sarcoidosis or Langerhans cell histiocytosis. And again, I just want you to have heard these terms so that when you see these patients in school, it triggers something that says, oh, okay, we need to think about adrenal insufficiency in these patients. So we've seen that there's a wide variety of causes of AI, and a wide variety of hormones can be affected. So the signs and symptoms of AI depends on which hormone is affected. Although most symptoms are pretty nonspecific, which is difficult. So for primary AI, that is, the adrenal glands themselves do not make enough hormone, we tend to see fatigue, nausea, vomiting. We see those electrolyte abnormalities, including hypoglycemia, and we see skin hyperpigmentation. In central adrenal insufficiency, we also see weakness, fatigue, hypoglycemia. Electrolytes usually are normal in these patients, and we don't tend to see that skin hyperpigmentation. And then in a patient who has undiagnosed, untreated, or undertreated central AI, you will also see signs and symptoms of the underlying disorder, including those multiple hormone deficiencies, potentially evidence of other brain abnormalities, or evidence of a brain mass, such as a tumor. So I have a case here for you all. So you have a 15-year-old boy who comes into the school nurse office. He's complaining about dizziness upon standing. He has morning headaches. They frequently make him late for school. He has poor appetite. He's been losing weight. His grades have been slipping. So which of the following do you suspect in this patient? Anorexia nervosa, infectious mononucleosis, depression, adrenal insufficiency, or E, all of the above?
So, Dr. McCleary, I created a polling question so people can
Oh, awesome.
uh, participate. But I'm trying to, for some reason, it's not pulling up. So if we could just have everyone put their answer in the chat, maybe?
That sounds good.
A, B, C, D, or E. So let's put some answers in here and see what we get. Okay. Looks like we have a lot of E's. We have one D up
Great.
here.
Great.
So
Great.
lots of E's.
Perfect. So yeah, this question is really to demonstrate that the signs and symptoms of adrenal insufficiency mimic other conditions. So you could be thinking about any of these conditions in this patient. Things that kind of make you wonder about adrenal insufficiency include these symptoms that he's having of morning headaches, which potentially can be associated with a brain mass, vomiting, things like that. So you always want to think about adrenal insufficiency. Keep that on your differential. A careful family and medical history can help identify things that make you hone in on that diagnosis of adrenal insufficiency. So just keep a high suspicion for that condition, even in patients who don't already have that diagnosis. Okay. So for patients with adrenal insufficiency, an adrenal crisis is precipitated by an absolute or relative steroid deficiency. So thinking back as to what the adrenal hormones do in our body, if we have a deficiency in those hormones, you're going to have issues with blood pressure. You're going to have electrolyte abnormalities, low blood sugar. Um, so this can be a medical emergency in these patients. So these differences, the deficiency in the steroid levels can be caused by stress, including unknown, untreated, or undertreated adrenal insufficiency, discontinuation of long-term steroids or interruption of steroids, major surgery, infection, trauma, seizure, or vomiting and diarrhea. And again, this is a medical emergency and must be recognized and treated promptly. So a lot of these causes of an adrenal crisis are body states in which you need more steroid than perhaps they're already getting from their maintenance medication, which we'll chat about more. I will say that vomiting and diarrhea account for many cases because that maintenance medication cannot be absorbed. So the signs and symptoms of an adrenal crisis are also pretty vague. They include headache, nausea and vomiting, fever, dizziness, stomach pain, loss of appetite, confusion, maybe a syncopal event. These symptoms can rapidly progress to hypotension, shock, and sometimes death. So again, they must be treated promptly. And so for a student with known AI, their health plan, their individual health plan should identify signs and symptoms that the students may experience that signal an adrenal crisis and the treatment that you should give based on those symptoms. So here's another case for you all. So a 16-year-old high school student, she has vomiting and diarrhea from food poisoning. She is chronically treated with steroids for asthma, and she is weak, confused, and has low blood sugar. So what is the most likely cause of her symptoms? A, dehydration, B, hypoglycemia, C, an asthma attack, or D, adrenal crisis?
All right, we're seeing D's and B's. There's an A in there as well. but lots of D's, couple of A's.
Okay. So yes, absolutely right. She is dehydrated. She does have hypoglycemia, but um, she is also in an adrenal crisis from not being able to absorb those chronic steroids that she's on. Um, so the bottom line, oops, for recognizing an adrenal crisis is that the symptoms of adrenal crisis may mimic symptoms of many other illnesses or disease. And the key is to inquire about a diagnosis of adrenal insufficiency and to consult that student's individual health plan for those specific signs and symptoms that would necessitate an emergency medication. So, on to medications now. There are many medications that a student may be prescribed to treat adrenal insufficiency. And so, the mainstay of these patients' treatment is maintenance therapy of daily steroids to mimic the body's natural stress response. These medications are generally oral steroids that are taken multiple times a day. During times of mild illness, children with adrenal insufficiency will need a stress dose of steroids to mimic the body's increased cortisol needs during these times. And this is typically double or triple their maintenance dose. And it is, again, often oral. During times of suspected adrenal crisis, additional doses of oral medication may be necessary or an injectable medication an injectable hydrocortisone such as Solu-Cortef or Solu-Medrol, which we will chat more about. These medications are given intramuscularly, which means that it's injected into the large muscle such as the thigh. And then again, consult the student's individual health plan for the appropriate medication and administration. A prescriber order for medication will include the student's name, the medication, the dose, the method of administration, whether it's oral or intramuscular, and then the time or symptoms that require administration of that medication. Okay, one last case. So an elementary student with Addison's disease, so that's an autoimmune cause of adrenal insufficiency, falls during recess and is scraped to the knees and elbows. He's limping but doesn't appear to have a broken bone. He begins to complain about a stomach ache. What is the most appropriate next step? A, call EMS. B, give a stress dose of steroids. C, give him some juice. Or D, let him rest in your office.
Okay. We have B, several B's. There's an A, call EMS. Several more B's for the giving him a stress dose.
Great. Yeah, so while his injuries are not severe, he may be experiencing an adrenal crisis and he should be given an oral stress dose or an injection based on his individual health plan and his prescriber orders. An oral dose may be appropriate if that is what is indicated on his individual health plan, since at this point he seems to be able to take oral medication. And it would not be wrong to call EMS first as well, which we will talk about. Okay, so we've referred a lot to a student's individual health plan and their emergency care plans. So these will vary based on the individual student and the school district as they formulate these documents. But I'm going to share some examples of some forms that you may come across. This is an example of an adrenal insufficiency action plan from Seattle Children's Hospital, and it has all the different treatment modalities laid out for us. So up there in green, we see the maintenance medications listed at the very top, including the timing, the dose, and the route. The stress dose in yellow is outlined with very clear instructions about how to take these medications and when to take them. So for fever of 38.0 Celsius or higher, diarrhea, a viral illness, infections requiring antibiotics, serious trauma. And then finally, we have the emergency management outlined at the bottom. So if you're not able to take any medication by mouth, to give the intramuscular medication. There's a few documents published by the NADF, or the National Adrenal Diseases Foundation. On the left, we have their emergency care crisis alert flyer, which outlines emergency room treatment of adrenal crisis, and the NADF recommends that all patients with AI have this in their emergency kit. On the right is the NADF version of the adrenal insufficiency action plan. It's essentially identical to the Seattle Children's one that I showed you before. And then this is an example of an emergency response card that a student with AI might have with them to give to EMS or to emergency room providers. And this flowchart is very similar to the NADF emergency care crisis alert flyer. And then students and families may already have an emergency kit that they are familiar with. The NADF recommends carrying the following supplies in an adrenal emergency kit. So an emergency contact information and doctor information, the NADF emergency care crisis alert flyer that we saw in the previous slide, an adrenal crisis care letter for emergency staff, a hydrocortisone in a Solu-Cortef Actovial, syringes, needles, and alcohol swabs. And I have the recommended storage temperatures for that Actovial here to 68 to 77 degrees Fahrenheit. So you may see students that have a special carrying case for this medication that keeps it at that temperature, especially in summer months. Okay. Now we're going to talk about how to actually give this emergency injection. So the supply list here mirrors the NADF emergency kit recommendations. So prior to giving the injection, call 911 so that EMS is already on the way, and then prepare the student. The injection will likely be given in the lateral thigh like we talked about. So the student will likely have to undress to some degree. This should occur obviously in a private location, and the patient should be as comfortable as possible. And consider using a blanket or a curtain to give them some privacy. And then it's recommended that 2 personnel be present if possible. And of course, wash your hands and put on gloves. So most of the students' medication will likely come in an Actovial, and we've seen a couple examples of this already. So an Actovial keeps the medication in a powdered form, so it needs to be mixed prior to administration. So double check the expiration date on your Actovial. You push the stopper with your thumb, so that will drop the powder into the liquid to dissolve that powder. And then you mix the powder and the solution in a swirling motion. Don't shake it back and forth, swirl it, and we'll see a video that demonstrates this as well. You confirm it's completely mixed. Just look at the solution, making sure that all that powder is dissolved. Remove that yellow tab at the top. Wipe the top with an alcohol prep pad. And then take out your syringe with your needle. So the prescribing doctor should provide guidance about the appropriate needle size and prescribe a needle. It's typically a 22 to 25 gauge and a 1 to 1.5 inch long needle. Insert the needle completely through that rubber stopper, and then invert the vial and gently insert air from the syringe. So the dose, they are going to draw up the correct dose. This will be, again, spelled out in the individualized treatment plan. It will likely be 50 milligrams or 1 milliliter of that Actovial for elementary aged children, and larger, 100 milligrams or 2 milliliters of that Actovial for older kids and adolescents. But again, just refer to the individualized treatment plan. So drop that dose, and And then place the cap gently back on the syringe and remove any air that's still in that syringe. And then the student-specific injection site, again, should be spelled out in the treatment plan. Most students will be able to use the thigh. So think of the thigh in thirds. Upper third, middle third, and lower third. You can see the marker here on this thigh, just for illustrative purposes. So the proper injection site will generally be in the middle third of that thigh on the lateral aspect or the outer portion of that thigh. So ID your injection site, clean the injection site, and then hold that site taut, hold the syringe similar to a dart, and then push the needle into the muscle at a 90-degree angle or straight down. The needle should be pushed in at least 3/4 of the way of its length, and then briskly push the plunger to administer the medication if you do not see any blood in the syringe. If you do see blood in the syringe, remove the needle, prepare a new syringe and another active vial. If you do not have another active vial and you see blood in the syringe, gently back the needle out, adjust your angle, and then push it back at least 3/4 of the way and pull back slightly on that syringe. If no more blood appears, then you can briskly push in the plunger. And then once the injection is complete, withdraw the syringe and apply pressure and a bandage. Okay, here's a brief video from the Children's Hospital of Philadelphia that shows these exact same steps of giving the emergency injection. It's just a few minutes long.
Your child's doctor has prescribed a Solu-Cortef, also called hydrocortisone injection, to be given if your child is unable to take the hydrocortisone stress dose by mouth. You will need to give the injection if your child vomits one time and looks very ill, vomits more than one time, is extremely weak or unresponsive. To be prepared for an emergency, keep a Solu-Cortef active vial with you at all times. Giving the Solu-Cortef injection can save your child's life. I will now show you the steps for mixing and giving a dose of Solu-Cortef. Wash your hands.
Oops, I'm so sorry.
Gather your supplies. You will need a Solu-Cortef active vial, this is also called hydrocortisone, a syringe with needle, alcohol pads, and a cotton ball. The Solu-Cortef comes in a 2-chambered vial called an active vial. The medication is in a powdered form and needs to be mixed before giving. To mix the medication, push down on the top of the vial to release the cork. Gently swirl the vial. Allow all the powder to dissolve. To remove the medication from the vial, remove the center cover. Wipe with an alcohol pad. Allow to dry. Open the package containing syringe with needle. Twist needle to tighten. Remove the cap from the needle. Push the needle in the center of the stopper. Turn the vial upside down. Pull back until you have the correct amount. Remove air from syringe by tapping and push out any air bubbles. Check that you have the right amount of medication. Remove the needle from vial. Carefully replace the cap. To give the medication, clean the outer thigh with an alcohol pad. Allow to dry. Remove the needle cap. Grasp the muscle with thumb and fingers. Hold syringe like a pencil or dart. Quickly insert the needle into skin. Push the plunger to release the medication. Remove the needle from the muscle. Apply pressure with cotton ball. Immediately after giving the injection, call 911 or your child's doctor.
Okay,
Your child's doctor.
there we go. Okay, it looks like there's some people who weren't able to hear that video. I think all of the information, all of the resources will be sent out, including links to this video and other videos. So hopefully you can, for those who didn't hear the audio, you can refer to it afterwards.
And Dr. McCleary, if anyone would like to have a link to the video, I'd be happy to send that out after our meeting. So my email is in the chat. Please feel free to email me if you'd like a copy of that link.
Great, thank you. So after you give the intramuscular injection, call 911 if that has not already been done, or have someone else call 911, and then notify the student's parents if you haven't already done that. I will say, if you're strongly suspecting an adrenal crisis, don't delay giving the injection to do anything else. As we've heard multiple times, this injection could save the patient's life. So if it's going to take too much time to call 911 or call the parents, contact parents, just give the injection, and then you can notify the appropriate people afterwards. Do not leave these students unattended. Make sure that they're actively being monitored by you or by someone else who knows what to look for until EMS arrives. You'll want to turn these students on their side and monitor their breathing. And then if their clinical status deteriorates, be sure to call 911 and update EMS with what is happening with this student. After the incident, the parents are responsible for contacting the student's doctor and for obtaining replacement emergency medications and providing those to the school. And then make sure that you document this incident. Here we go. Okay, a quick note on legal immunity. So the state of Washington has passed legislation stating that a school district employee or a PDA, a parent designated adult, is not liable for any criminal or civil action as a result of providing treatment to a student with adrenal insufficiency, as long as they're acting in good faith. So again, if you are considering an adrenal crisis in these students, don't think twice, give that injection, and it can save their life. Regarding other potential accommodations for these patients with adrenal insufficiency, again, we've seen they must have access to any maintenance medications or emergency medications. They must be appropriately monitored of their health status in a reasonable way, and then have resources for an appropriate emergency medical response if needed, either a school nurse or a PDA present. Students with adrenal insufficiency may need constant access to water or unrestricted bathroom access, and those are those patients who have issues with electrolyte regulation or water balance in their bodies. They should be able to drink water as needed and go to the bathroom as needed. They may also need limitations for physical activity, especially in higher temperature or humidity. And then, of course, like I said before, emergency medications must always be accessible. And finally, a parent can also always advocate for a 504 plan for their child that spell out any other specific accommodations. Okay, these are some great resources on adrenal insufficiency. A lot of these I referenced in the presentation. We watched this video from the Children's Hospital of Philadelphia, and there's links to all of these resources in this slide. A a lot of these resources are from the National Adrenal Diseases Foundation, including more information on how to administer solid Cortef. There's some great information from the Oregon Health Authority and the Oregon School Nurses Association, just as reference. And then we have a lot of examples of adrenal crisis alert flyers, emergency response cards, action plans, some more patient and family education from the NADF and Seattle Children's Hospital. And then at the bottom here are the legislation that pertains to students with AI that you can reference. And then here are just some additional references that I found helpful. That is all I have. I'm happy to take any questions. Any clarification, please let me know.
We have some clapping hands for you. Thank you for all of that information. I haven't seen any questions quite yet in the chat, but I did want to ask if you wouldn't mind, you had that timeline, and we're talking about if a student was in crisis and we need to alert EMS to do the injection first and then call EMS because the injection is more important at that time. What time frame do we usually have to give that dose to students?
It really depends. And like I said, these students, if you're seeing symptoms, signs and symptoms of adrenal crisis, they can deteriorate very, very quickly. So again, it's important to not delay giving this injection, to give that injection as soon as possible, not to delay calling EMS, alerting parents, any of that. And it's also maybe helpful to delegate the tasks of contacting EMS, calling 911, and contacting the parent to someone else who cannot give the injection. If you are the person that is at the school and can give the injection, that is your most important job at that point.
All right, we do have some questions in the chat. Let me see here. We have let me scoot back to where it was.
So we
Doctor,
have
can you see the chat now?
there's ESD
Yes,
105.
I can see it.
Yeah,
She can see the chat, so maybe.
Oh, perfect. So ESD 105 did ask if transport is required or just to call EMS.
So I would say if in these patients who you're considering an adrenal crisis and you give them that injection, at the very least, they do need to be transported to the emergency department. They're going to need some IV fluids. They're going to need monitoring that needs to happen in a hospital setting. So unless I can't think of a scenario where this patient would not be transported to the nearest emergency department. Let me see here.
Oh, there are a couple asking about the presentation and the slides being made available to them, and we will make sure that they get out to our participants today so they can have this as a resource. There was a question about who is doing the PDA trainings for SoluCortef injections.
Yeah.
Continues. I have learned Seattle Children's is working on developing a class, and Confluence does not offer this type of PDA training.
Yeah, so I didn't see anything currently offered by Seattle Children's, but it's great to hear that they are doing that. This type of training would need to come. I mean, there are some resources from the NADF and from other organizations advocating for patients with adrenal insufficiency. I think it's great that Seattle Children is providing some of this training. Confluence, we don't have pediatric endocrinologists at Confluence Health. We just have adult endocrinologists. And so I would want that training to come from the offices that are seeing these patients and that are prescribing the SoloCortef to these patients. And that's going to be Seattle Children's or Sacred Heart in Spokane.
Okay. We have another question. Do you ever see where students, where these students are needle phobic? Any recommendations when you need to remove clothing to give medications and students are refusing?
Yeah, this is really tricky. I mean, you kind of have to balance the emergent nature of giving this medication with respecting the student, not traumatizing the student, and trying to make them as comfortable as possible. So I would say prior to even bringing out your supplies and your needles and your SoloCortef vials, to just work with the student, try to make sure that they're as comfortable as possible. Maybe having some other people there who they're comfortable with, who can hold their hands, is really helpful, so that you can focus on trying to give that injection as quickly as possible. If they're refusing to take off their medication, sometimes you can consider other large muscles to give the injection in. And for larger students, you could do that in the deltoid. For smaller students, that you may be able to just pull up their pants really quick and give it. And I think it's just that balance of trying to make them comfortable, respecting them, but making sure that they get this emergency medication.
Thank you. Are there any other questions for Dr. McCleary?
I was going to add to just to what Dr. McCleary said. I think is just probably even just working with the student and with the parents on seeing how you can try to get the student as comfortable as you can, and educating, obviously, depending on the age level. Some might be able to understand better than others. But I think it's that prior education before you have to use it is going to be a big thing too.
Absolutely, absolutely. All right. Other
I see a
questions?
question about expired medications. Yeah, ideally you would give any expired medications to your patient if it's expired but no other available. Yeah, that's a tricky question. I think I would call EMS, describe the situation to them, see if they have any ability to give any hydrocortisone injections. If they did not, if the patient is deteriorating, I would give that injection. And you're acting in good faith. You're trying to do what you can for that patient. And if it's not available, if EMS is not there, or they don't have steroid medication to give the patient, then I think I would give that medication. Hopefully that would never happen. I actually don't know the shelf life of a SoloCortef vial, and you should be reviewing the patient's individual health plan at least yearly. So hopefully that would be caught, and appropriate unexpired emergency medication should be available.
Something that I'm also suggesting to the school nurses as I'm doing the visits is, if you notice that the medication is expiring that school year, right when you get it, just put a little sticky note right in front of it, so you know it's going to expire during the school year.
Blanc, I'm going to piggyback off of that. I told my nurses that to put a calendar invite so it shows up as it gets closer.
There you go. Lots of tips.
Good idea.
There is one more. Also create an electronic alert, like Anitra Marino was saying. Are there any other questions or comments for Dr. McCleary? Um, oh, Rebecca shared that their district has a monthly medication expiration calendar that they use. So that's a really great idea. Yes, to reiterate from all of those that are putting it in the chat, we just want to say thank you so much. This was really great information for us, and we really appreciate you being here. There's lots of people that have been putting that in the chat, so thank you, Dr. McCleary. Are there any other questions or comments? I like the idea of the district-wide medication calendar as well. Sorry, I can only do a few things at a time here. So any other questions or comments for Dr. McCleary? Will we have her with us? See.
Speak up now or forever hold your peace.
Yeah, there you go.
It's in the chat. Danitza put in there, is there any emergency symptoms we should look for if a student is untreated?
Yeah, so the symptoms for an adrenal crisis would be the same for a patient who is untreated or undiagnosed, has untreated or undiagnosed adrenal insufficiency, as those patients who have diagnosed adrenal insufficiency and are in crisis. So I'd refer back to that slide to look at those symptoms. And again, it's they're nonspecific, and there's a lot of reasons why a student, especially one who's undiagnosed, would have those symptoms. But just to keep adrenal insufficiency in the back of your mind, especially if they're having other concerning symptoms.
Awesome. Just out of curiosity, it seems like adrenal insufficiency is becoming more and more of a diagnosis. What are the rates of students or rates of people in the state in general diagnosed with this? Is it increasing or?
That's an excellent question, and I actually do not know. I think you're seeing it more in these patients. I do wonder, use of exogenous steroids is the most common cause of central adrenal insufficiency in children. So perhaps that prescribing is increasing, the prescribing of exogenous steroids leading to adrenal insufficiency and adrenal crisis. And then I don't know if the rates of I'm just looking at the chat with people, the number of patients they have with adrenal insufficiency. That's really interesting. I don't know if the rates of primary adrenal insufficiency is going up. That's an interesting question.
Annie has her hand up.
We have the district assessment well, I'm not even going to try to remember the actual title of it, where we've been collecting that information for a few years as far as how many students in Washington State have orders for adrenal corticosteroids. It's been fairly stable at about 200 for the whole state. Now, we don't get 100% completion of that data, but last year was the closest we've had to 100%. It was really high, and it was 210. So I'm hearing anecdotally from districts that there's an increase, but I'm not seeing it in the numbers in the data collection yet. What I did notice this year is there was more of it administered than had before. So we had 7 doses administered, and we've only been collecting the information for about, I want to say, 3 or 4 years.
Wow. Thank you, Annie.
You're welcome.
That's great. There's one, Rebecca in the chat put that out of the 7 buildings in our district, not according, okay, hang on. Out of my 7 buildings in our district, not accounting the other 10 buildings that I do not cover, I have 3 students at her building at my schools. So very interesting. All right. Well, we really appreciate your time today, and thank you everyone for joining us. We're really glad that you could be with us today. And Dr. McCleary, thank you so much. This was really great information for us, and we were so glad that you were willing to visit or present to us today. And
Thank you for having me. I did just put my email in the chat as well. If anybody has any questions, follow-up questions that they weren't able to ask here, I'll try to answer them. And then, yeah, hopefully you'll get all of the resources from this presentation. Thank you.
Yeah, thank you.
Dr.
All right.
McCleary, do you mind sending us this updated PowerPoint that you presented to us?
I have it.
Oh, you do have it?
Yeah.
Okay, perfect.
Yeah, I have it.
Thank you.
So we'll make sure that is available to everyone today so they can use this to help the students in their district and the staff that are helping their students as well. So thank you for everyone that out of our region that joined us. We're glad you could be with us today and hope you have a wonderful rest of your day. We are going to continue with our meeting. Although I don't see that we have Kristen Hosey from the Shalom Douglas Health District with us quite yet. Unfortunately, Dr. Wallace had a conference that he is at. So yes, thank you again, Dr. McCleary. So glad you could be with us. Like I said, Dr. Wallace is at a conference and he's not able to join us. So Kristen Hosey agreed to join us and tell us about the public health updates from our particular region. So I'm hoping that she'll be able to join us here shortly. While we are waiting for, I believe she is a doctor technically, right? She has a PhD, I think. While we're waiting for Kristen, I was wondering, I know you were listing out the number of students that you have in your district with adrenal insufficiency. What are some of the things that you have done to train the staff? Like, I know that is a big concern, and we haven't really gotten any direction from the state yet about those PDAs, but what are people doing to train their staff to give those active vials? Oh, yes, anyone that wants to stay is absolutely welcome to stay and join us for the rest of the meeting as well. And those of you that have students with adrenal insufficiency, please let us know what you do to, as far as training your staff. What process do you have in place? I'm asking because I have a nurse that I work with that is putting together a PDA training, just kind of a kit that she's going to use to work with her staff. And she's got everything from, the anatomy coloring book that we got in nursing school. Well, she has some of those pages, the anatomy coloring book, so that the PDAs know the anatomy and what's involved with the adrenal insufficiency. And she's working on getting some videos to help with learning how to inject the medication, like the one that Dr. McCleary used today. That was a great video, which I think she will most likely use. But when you are training your staff to do this, if you have any fantastic ideas, please put them in the chat because we would love to be able to collaborate and build on each other's ideas. But we do have Kristen, are you actually a doctor? Do I call you Dr. Hosey?
I mean, you can. You should call me Kristen. I have the doctorate in nursing. I'm not a medical doctor.
Okay. Sorry, it just slipped. I mean, I was talking about Dr. Wallace and then Dr. Hosey. Anyway, so thank you so much for joining us. I told the group that Dr. Wallace is out at a conference today, so you are joining us last minute, and we are so grateful for your willingness to be here and share with us what's happening in our region. So I'm going to turn the time over to you. You should be able to share your screen if you have anything that you'd like to share.
Yes. Let me do that real quick. Hi, everyone. And yeah, my name's Kristen Hosey. I'm the health administrator at Chelan Douglas Health District. And we're let's see if I share. Does it look like you can see a presentation now?
We got
All right,
it.
perfect. I'll zip through this. Just for the folks that don't know me, I became the health administrator in June of 2024. I actually hate this photo, so I like to talk about how I've been a public health nurse for at least 15 years. I moved maybe 20 at this point. I moved to Wenatchee in 2016. I worked at Wenatchee Valley College. I was the nursing director for a few years between 2016 and then wrapped up 2020 through the pandemic, which was awesome. The beginning of it. And then working on the RN to BSN and the LPN to BSN program. And I faculty in OMAC for a few years, so I got a lot of strong ties with Okanagan. And we actually support Okanagan Health District with epidemiology and surveillance work as well. So it's a nice overlap. So my presentation today is just a little intro, which you saw. Some communicable disease updates, which is usually what Dr. Wallace presents on, specifically looking at avian flu, botulism, and then we have a newish respiratory illness dashboard. I'd also want to let you guys know that we're doing a formula drive, and we'll talk about that in a minute. And then you may be interested in some of the community health assessment info that we have online. If you're writing grants or something else, this information might be helpful as well. So I'll just keep going. So about a week ago, I think, maybe it's been 2, we did our quarterly notifiable conditions event. This is the first slide of that event. And we did it on avian flu. We were lucky to have some folks from Grant County come on and talk, as well as from the Department of Health, about the response for avian flu. It is a notifiable condition. And so these are some of the slides from that presentation, and they're also available on our website. This one and any of our previous notifiable conditions, they're usually held quarterly. So our next one will be the first Thursday in February at noon, and it's online, so we record it as well. Something just so that you guys are probably aware of is that there's a number of conditions through the WACs and RCWs that are reportable, and some of them are immediately reportable. Some of them are 24 hours or within 3 days or 30 days. And this can be school nurses, but it often is our labs and our hospital facilities and our providers that are getting those suspicions in about a case that is a notifiable condition. And so novel or unsubtypable influenza, which is what we have for avian flu, is a notifiable condition. But does anybody know, do you guys know if it's immediately notifiable? 3 days? How big of a deal? Think about it. If anyone wants to yell it out, they can. But it's like room participation. You can see I used to teach, right? It's actually immediately notifiable. So our healthcare providers and facilities should let us know the second they have a novel or unsubtypable influenza case. They would just call us. And if something is like immediate, you'll call anytime. We have after hours call, you just call our normal line and somebody will pick up to just let them know we have a case. And so we can start that investigation. We also have influenza associated deaths that are something that's influenza related that are notifiable, but doesn't have to be right away because it's kind of after the fact we usually get that information. So highly pathogenic avian influenza, I think Dr. Wells has talked about it before. We still are not seeing human to human transmission, which is why we are so concerned about surveying for avian flu is to really get ahead of that. However, we're seeing it in all sorts of animals. We got cats, we got dogs, we've got domestic animals, but we also have wildlife that also are contracting it. And so having like avian flu in a area is something we want to make sure that we're not only watching for, but also if we have it in the food, it is an impact economically. It can also have an impact on food security, et cetera, right? So we have Grant County had last month in October a outbreak of bird flu at one of their facilities. Thousands of birds were dying of bird flu. They got them tested. They came back positive as having avian influenza. And so then they ended up having to depopulate 2 million birds. And so that was a big undertaking for that facility. There were about 300 people that were either there as employees normally or there for the response to that like depopulation response that were exposed to avian flu. And so on the Grant County health districts, and they were monitoring for any signs of avian flu and doing some testing for avian flu with the employees there. We're happy to say as of now, we've had 0 human cases from that outbreak. But if you want to learn more about it, like I said, we had Amber McCoy, who actually presented from Grant County, that can talk about that. And that's been wrapped up. But there was a new case on the 13th at Grays Harbor County of a person that has contracted avian flu. We don't have a lot of information on it, but it looks like it is not H5N1. I want to say it's I should have written down if it was H5N3 or there's a 3 or 5 in there. I got to remember. Dr. Wells is actually meeting with other health officers today to learn a bit more about this case. So we usually just want to make sure that folks that are potentially could be exposed, a lot of the ones for Chelan Douglas and Okanagan would be more backyard poultry that someone might be exposed to avian flu. How would they find out? They would, if their animals are sick or dying, they can get them tested. Not by us. We don't do that. It would either be Department of Ag or Fish and Wildlife, or if it's one of your own pets, you could go to the vet and get those tested. And those individuals would notify us, or they should notify us if the case is up in the animal avian flu, so we can follow up on the symptom monitoring and screening and testing. And the test is really like we're finding out if they have flu, and if they meet some of that screening criteria, then we'll Confluence Health can do an extra level test to figure out if it's like the subtype of it, or we can help them send it off to the public health lab. So again, just a little bit more information. Don't handle dead animals is one way to prevent contracting it. Wear gloves, masks, do hand washing, your normal stuff. If folks do have dead animals, they can report and get those tested. Ag workers, the same. Our folks were doing really good on wearing their PPE. I say "are" because some of them were actually Douglas County residents as well, that we handled a couple of the monitoring for it. For most part, it was Grant County for those employees. They did a great job of wearing their PPE and following safety guidelines. And then, you know, for folks that own backyard poultry, just like keeping those flocks enclosed is really helpful because, like they said, there's wild birds that can get it, like geese and other birds can get avian flu. And definitely isolating if they're sick birds from the rest of the group. And really important, one of the ways that we're hoping to prevent human to human transmission is having folks get their seasonal flu vaccine. That it will help as well. So I left a lot of links in there for you guys around avian flu. Another thing that has come up recently is there's been an infant botulism outbreak linked to some formula. So it's the By Heart Whole Nutrition Infant Formula. We've only seen one case in Washington, Lewis County, but wanted to let you guys know this. If you do hear of anybody that has that formula, we like to report it so that we can actually, instead of throwing it away, we can get it tested. It's nice to be able to do that. So just reach out to us, reach out to your healthcare provider. Botulism is pretty serious and it actually is a notifiable condition. So what do we think? Any thoughts on botulism? Immediate, 3 days, a month? What do you guys
Put it in
think?
the chat, like what we think,
The
like
chat?
3 days. So that way, yeah.
Oh yeah, we got some immediates. Yeah. You guys know this one, botulism. It's not a joke, right? It's definitely immediately. This one actually isn't veterinarians. I thought I copied over not the veterinarian part, but it looks like I didn't. But it would be for healthcare providers, healthcare facilities. We definitely want to figure out if someone has botulism or suspected botulism. ASAP, so we can get that antitoxin, help coordinate with the facility to get that antitoxin ordered. So that's just why it's also immediate, and then we'll do the follow-up investigation. Okay, so we have a new respiratory illness dashboard, and I'll drop the link in the chat, but I wanted to zip through a couple of the slides so that you guys can see it. This is just now launched. The respiratory season has, illness has started. This one's going to look a little different because this is our pediatric one that's for Chelan, Douglas, and Okanagan. And then you can also click on it for regional info. But right now we just have Chelan, Douglas, and Okanagan. We're hoping to expand out to Grant and Kittitas counties too. If you go on the DOH website, it's by region and it doesn't boil down to the counties. And that's why we've decided to do this type of dashboard for Salina Douglas, and then we're working on Okanagan, which is up there as well. And so for this one, you can kind of see respiratory. This one's influenza by age group, and the reason we're doing that is you can kind of tell that, okay, this year so far we are seeing a little bit of cases here that spiked up for a minute in the 5 to 17 group, and then shortly after that 0 to 4 group. So we want to do it by age group to see, is it, a lot of times I think folks think, oh, it's 65 or older, but we wanted to see those trends by age group as well. So you can see that for, if you click through our little tabs, you can see that in our dashboard. Another example is COVID-19, same thing. We've got it by age group. You can see that pink line is at 65 and older. This is again Chelan Douglas, but when you get on our website, you can click Okanagan. And so there's also, and I thought I copied one in here, but I kind of did this quickly. There's also one that shows the trends from last year. So because we didn't break down by age last year, you're only going to see this, but the ones that are for influenza, COVID, RSV from the last couple years, you'll see a graph where there's a different line for like the last year, I think maybe even 2 years. And then where we sit nowadays with starting into the respiratory illness season. So something to kind of check out. Okay, formula drive. I'm trying to zip through. So we are doing a formula drive here at Chelan Douglas, meaning people can drop off formula for families in need. We're doing it through the month of November. The most needed formula types are listed here: Similac, Advanced, Sensitive, Total Comfort, or Infamil. We also will take store brand equivalents to it. You can donate here in East Wenatchee, Upper Valley Mend, which is in Leavenworth during their operating hours, and you can see how fast I did this presentation, Cheland. We're going to Cheland and Douglas counties, but some of the fire stations listed here also will take donations. And then for families that need formula, they can pick up here on Tuesdays like today, or Upper Valley Mend. They're open Monday to Friday from 11 to 5 and Saturday from 11 to 2. And so basically Upper Valley Mend, you can drop off and pick up any of those days. For us, we're just like focusing our pickup days on Tuesdays, so that we're organized and have all of the formula ready. And of course, if we see the formula that is associated with botulism, we're pulling those out, and we have those now that we can send off to get tested. The last thing is community health assessments, I think on my list. And so on our website, we have this page called Health Data, and we had our previous community health assessments up here, but now we are adding what's called CHA chapters. And so far we've done a behavioral health CHA. Well, we have a demographic one that just has basic information on Chelan Douglas. And we've published one for behavioral health. And I think this week we will have one up for maternal child health. So check back on our website. It is, I think, just got translated into Spanish. So after we did the behavioral health trial, we actually hosted an event with a lot of folks that work in behavioral health and substance use. Oh, what's happening can you guys see me? Okay, my computer is being weird. And we may do something similar with maternal child health, but I wanted to give you kind of a look at what that looks like. We'll have data in these chapters that are pulled from other resources. It could be the Healthy Youth Surveys. It could be other like national databases or state databases. Trying to get an idea of where Chelan Douglas sits in different areas. And we call them chapters so we can focus in on specific indicators around whether it's behavioral health, substance use, maternal child health, chronic disease or injury prevention. So I just wanted you guys to see that we are working on pulling more data. It's the first time we've been able to do this in a while, but now that I have some EPIs on my team, we're pulling these reports together, and that information is for you guys. And if you need it, write grants, you can be able to see like, okay, what is our readiness looking like for kiddos in Chelan and Douglas County by school district? What are we seeing for childcare costs, etc. That's the kind of stuff that's going to be in the maternal child health report. And look for a couple more of those reports coming out. And the end of those chapters will have a whole link to all of our references for that. So that's kind of my presentation for today. I hope that's kind of what you guys were looking for, and I'm happy to answer questions.
Kristen, thank you so much for being with us. We appreciate you throwing that information for us together. I do want to tell you that Amber McCoy is on with us today too, and she said that it's H5N5.
There you go. Great. Thanks. Thanks, Amber. Put that in the slide real quick before I send it to you guys.
Kristen, do you mind sending us a link to that one where you were showing us the viral influenza data? I was trying to look for it, but maybe I got lost in there somewhere.
Oh, and I'll tell you that we're going to update our website soon, so hopefully it'll be a little bit more easy to navigate. Of course, I say soon, but you know how those things take. We'll start it very soon, but I don't know how long it'll take for us to get it over.
The excitement is there, right? The excitement is soon. It's happening now.
Yeah, exactly. Exactly. Yeah, I'll drop it in right now. I don't know if anybody has any questions they wanted to ask, or I can stay on.
Or Amber, is there anything from Grant County that you want to add for us too?
No, just as Kristen mentioned, we're wrapping up our avian influenza response. There were some mice and some other birds that tested positive for H5N1 last month. October was pretty busy for avian influenza in Grant County. I know the health officers just sent out a letter to the healthcare community, and I'm not sure if it made it to school nurses, but they're using a little bit different thresholds this year for respiratory virus season, as far as when to basically declare, basically when to start the influenza respiratory virus interventions in different facilities. So I'm not sure if you all got that letter, or if you want it, we can make sure to send that out to school nurses as well. It's mostly used for used by healthcare facilities, hospitals, and things that there's just some different thresholds to watch for that indicate that the viruses, specifically influenza and RSV, are at like an epidemic threshold in the community, and when to start implementing those different procedures like masking and different things in those facilities. We can send that out.
Okay.
Just a reminder to keep calling us with different things. I had a call from a school nurse about a possible varicella this morning. Just encouraging kids to go get tested, just because varicella, chickenpox is one of those things that gets misdiagnosed rather frequently. And I know we've had a lot of hand, foot, and mouth going around in our community. So just always default to sending them to the doctor and getting that test done. Because a lot of doctors they're really not even familiar with what chickenpox looks like anymore, because it's so uncommon. But so encouraging them to actually swab the pustules. So sorry, that's all I can think of off the top of my head right now.
I appreciate it. Thank you.
Yeah,
I
we're just
didn't realize
preparing for respiratory virus season around here and waiting for those calls to start coming in. So
Well,
Yeah.
I appreciate your note on the varicella too. That's important for us to remember, that sometimes these doctors haven't seen them ever. So
yeah, and sometimes they'll diagnose chicken pox without doing a test, and it turns out that it a lot of times isn't varicella. So and that can mean a lot for a classroom, especially if there's unvaccinated kiddos in there. So we want to make sure to get a correct diagnosis on those things.
okay, I have kind of a silly question. So with the avian flu, what do we, for our students that are in FFA, or students that we know are on farms or have animals, what kind of precautions do we need to tell them to be taking? Or like, because you can just picture these clubs like out there with their animals. What can we advise them of?
Yeah, that's a good point. I hadn't really considered the FFA kids. Yeah, I mean, avian influenza is it's deadly for chickens, and that's why they call it highly pathogenic, because it's based on how fast it kills the chickens. So if there's any kids that are having any illness or mortality among their flock, then that would be definitely something to be concerned about, that they should be reporting to Department of Agriculture right away to see if it's could possibly be avian influenza. And if that was the case, then we would definitely be looking for any signs of respiratory symptoms in any people that had contact with those animals. So that's what I would look for, is if there's a student that's reporting that their flock is dying or sick for some reason. I think I would maybe, well, obviously suggest that they call Department of Agriculture, but it might even be worth a call to, if they're showing symptoms, to encourage them to be evaluated, but give public health a call first. So we can help guide that. Because if somebody is symptomatic and having, you know, and they have sick or dying animals and a little bit higher risk for possible avian influenza, we would probably want to call the healthcare facility to give them a heads up before that person presented, just to make sure that they're able to take proper precautions, airborne precautions with that individual.
Thank you. And there, Kristen and Blanca have also been putting resources in the chat for us as well. So, so that can be, we can address those should they come up in our schools. So, thank you so much for joining us today. We really appreciate the information that you gave us and the heads up on some of these things that we might be seeing in the health room. So thank you. All right. I'm going to now turn the time over to our school nurse, or administrator Blanca, for school nurse updates at this time. Thank you. Blanca, you're muted. Okay, there you go.
Yeah. Trying to multitask. Good morning, everybody. It's nice to see everyone here today. I have a few updates for you guys. So we're gonna go ahead and get started, and then a little bit of self-care afterwards, because you guys know me. So one of the updates that I wanted to give you guys, which, you know, a lot of these updates that I like to put is, I put them in the newsletter, but I know how much information I provide to you guys in the newsletter. So I try to put in maybe the top 5, 6 things that I want to make sure that you guys have. So one of them is just remembering that, or knowing that 26-27 school year, there is an RCW taking place that we do need to have the bleeding control equipment and training for our staff and in our school. So just making sure that a lot of you guys, as I'm going to the site visits, you already have a lot of the things in place, but just double checking, making sure that you are following the RCW and checking with your supervisor, your superintendent on that.
Blanca, would you mind showing your slides as a slideshow?
Oh, it's not on there? Oh, as a slideshow.
Slides are on there, but yeah, thank you.
Okay, thank you. Yeah, so that's one thing. The other thing is just knowing that there's been an update on the opiate overdose reversal policy and training guidelines for schools. So just knowing that students can actually self-carry Narcan in this policy, but you still need to have trained staff that are able to activate and respond to any overdose. Currently, the ESD doesn't have supplies. I know there was a question going around asking if the ESD had any supply for students, for you guys to just, you know, hand off to students if they wanted to self-carry. But we currently do not. And we also asked DOH if they have any supply, but they don't have any. So the only thing that I can think of is, you know, if we still have the health department here, if, you know, if students can possibly just go and get it from the machine, I believe that you guys have in your health department if they want it. But as far as for the school, for us to give you guys extra Narcan, so if a student comes into the health room and says, hey, I want it, like, we don't have any, unfortunately. The other really cool thing that I just found out recently was that, so we all know that the school nurse, the comprehensive textbook just came out in 2025. And we all know that we pay a fee to Hiowa through our nursing license. So Hiowa has this book, you know, you can download it. It's a downloadable PDF that you can actually download and get more evidence-based information. So I would really encourage you guys to look into that, make an account through Hiowa and download the book. And, you know, when you get a chance, just start looking at what evidence-based information we have on there. The other thing that I want to show you guys is, so for my class 2 districts, we go do site visits, checking in to see how we can better support the team. But for class 1 districts, you don't have the support from us. So I wanted to just kind of give you guys our little cheat sheet of information if you guys want to do your own site tool. assessment, you're able to. I put this on the newsletter so that you can be able to just kind of look at your district and see what things you are doing awesome, what things you could improve, what processes could be better. So some things that I have on here is really like, health room management, making sure that you are doing your annual training, your general training, vision and hearing. Also checking in, do you have a process for your health history forms? On, making sure that you are retrieving all your health history forms. And if you don't have a process, how can you improve it? How can you work with your office staff on improving that? Same thing with immunizations. The other thing is making sure that you do have your nurse data set codes up to date. These will be especially handy during your district assessment. Also, remembering your health information, making sure that, you are keeping everything confidential, making sure that you have your emails encrypted or, following whatever procedure you guys are doing for your district and making sure that the information is confidential using fax, that kind of thing. Also, if you are doing any type of diabetes care, making sure that you have your CLIA waiver in place. And if you don't, we have information on here on how you can retrieve it, making sure that it's not expired. Also just environment, making sure that you have your, here's just a kind of a checklist on your health room environment equipment. Do you have an office that locks? Do you have cabinets that lock? Are your, emergency medication not locked and the other medication locked? Just kind of some check things that you can be doing for yourself. Same thing with equipment, making sure that you have the right equipment for your health room and schools. Eye wash stations are ones that don't seem to be in the health room at all, is what I'm kind of noticing. So if you don't have an eye wash station, what's your process? What's your plan? Usually it's in the science department. So, just creating a plan for that. Let's see here. Some other things, making sure that your equipment is up to date, your vision, hearing screeners, everything calibrated, double checking that your blood pressure, your thermometer, all that stuff is working. Your medication, this one's a big one. I would encourage you guys to just do your own self medication audit. Basically going through and saying, okay, no student medication orders at this time. All medications have been inventoried, making sure that they're correctly labeled, that every medication actually has a label on there, that it's been counted, that it's been verified. So this sheet just really goes through a pretty detailed, making sure that you are being compliant with all the medication that you have in the school. And epi in schools, making sure that, if you don't have stock epinephrine, just kind of think about having stock epinephrine. And if you don't know how to retrieve it, just, ask us and we'll support you in finding more information on that. Let's see here. Other stuff here, I'm going to kind of cruise through it a little bit because it does go into detail. Concussions, making sure that you have a plan on reporting your annual concussions to DOH. That's an RCW that we should be following. And I think, for many districts, just figuring out the process again and again every year, just coordinating with your athletic department, are they doing some? Are you guys doing some? Are you guys working as a team and sending it off? So just kind of making sure that you do have a process for reporting these concussions. Your health conditions, just double checking, making sure that the number of students that you have diagnosed with, your chronic health conditions, that they also have care plans. Because sometimes, we get really busy and we could forget one or two. So just making sure that you have health plans for the right amount of students that you have diagnosed with a certain chronic health condition. And also just double checking that you have your medication. Some of you guys have some really cool spreadsheets and the way you guys organize yourself. So go ahead and continue to do that. The other thing is just looking at your policies and procedures. When we get questions from you guys on consult questions, what we do is we'll probably ask you, what does your policy and procedure say? Because your policies and procedures could always be a little bit more strict than what the law gives us. So, making sure that you are looking at your policies and procedures, what is it that they say, but also reviewing them. So we have this list of policies and procedures from WASDA, and it has their last date that they updated them. So, either you and your administrator or, whatever process you guys have in your district, but just double checking with some of these policies and procedures, looking at the date that you guys have, and then looking at the date that WASDA has, and just kind of making sure you're up to date on that. One district that I looked at, Cascade School District, has a pretty nice example. I was actually pretty impressed. I told the superintendent yesterday. She has it very well, like where she has all of them like that, and then she has when it was last date updated on the website. So that just kind of makes it easy for her, she was saying, on making sure that she's up to date and current. So just kind of some ideas there. Obviously, you class ones are not required to do this, but I would highly encourage you to do that as, as yourself, as you yourself as a nurse, or do it as a district in whatever way works for you guys. Oh yeah, actually I missed this part right here. Also, just making sure that you guys have your own nurse license. I know that districts have their own coverage of insurance and everything, but if anything happens, you want to cover your own license. So, I think NSO only charges, I want to say, I don't know if it has it on here, but I think I only get like I pay only 100 something a year, and it comes out of my paycheck, out of my bank account, I mean, just automatically. So it's, I don't have to think about it and renew that every single time. But yeah, look into that, making sure that you have your own license just to, cover your end. Okay, so that's that. Job openings, please text all your friends, all your relatives, anyone and everyone you know. I know Wenatchee has some openings. Warden has some openings, has an opening, a full-time. We have an opening for a migrant nurse case manager, temporary. And Cascade School District now has an opening as well, full-time. So please message your friends, let them know. If they have any questions, have them reach out to me, to the district, and we can, give them more information on school nursing and what it's all about. Also later on today for class 2 districts, and if any of you class 1 wants to join, and if you guys have any questions, this is a very informal meeting that we'll have at 3 o'clock, 3 to 4, usually the third Tuesday of the month. Really, if there's any questions that you guys have, any collaboration that we can do together, please, join us. We'll be happy to see you guys there. And it'll be just, like I said, a little bit more intimate, just no agenda. And we'll just have some fun. This kind of leads me to my next slide.
Oh, Blanca, before you start with your next slide, there's someone in the chat from Highline said that they have a nurse opening as well. So if you have, I believe Highline is on the west side of the state. So if you have any relatives over there that might be interested, Highline has openings as well.
Yeah, and if you put it in the chat for us, that would be great. Make it easier for the nurses here. They can just copy and paste and send it to their family members.
There is a question for you in the chat from Brandy in Vashon. Do you require students to have a medication authorization form for Narcan?
For Narcan?
To carry Narcan. And Brandy, I believe that's covered in the standing order for the state. Correct me
Yes,
if I'm
that's
wrong,
what I believe as well. I need to look at it again, but I believe that's what it's covered. I don't think we need a medication admit. Yeah, it wouldn't make sense for us to have one. But if you put your information in the chat, I can't see the chat from here. That's why I feel like if you put your information on the chat, we can find that answer for you. Yeah. I can look at the a standing order again and double check. Let me just make myself a little note. Okay. All right. So now we get to play. I'm going to play this video, no pun intended. It's an 8-minute video, and it's really going to talk to us about the neuroscience of play and why it's fun. And I know that sometimes we can get really overwhelmed with everything that we have going on in our lives. But this video really touches on the importance of play and integrating it into your daily life and how we can get more creative in our life, in our things that we have to do and the stuff that we really don't want to do, but we have to do. We can get stuck in that. So it really talks about that. So I'm going to go ahead and play it for you guys. Let me know if you don't hear it.
Picture this. I'm watching a room full of senior tech leaders at Meta, let's just say, and they're engaging in what looks like a kindergarten game. They're passing an imaginary ball around, making whooshing sounds and giggling like little kids. Now, here's what fascinates me. Their brains are literally rewiring themselves for innovation in that moment. Neuroscience has revealed something remarkable about play. It's not just fun, it's your brain's favorite way to learn and innovate. Research from institutions like the National Institute for Play and studies on creativity highlight that play activates multiple brain networks simultaneously, promoting, there goes my alarm, promoting plasticity and fostering innovation. For example, a study published in Frontiers in Psychology found that engaging in playful activities enhances divergent thinking, which is a core component of creativity. Play stimulates areas like the prefrontal cortex, which is responsible for problem solving and creativity, and it increases brain connectivity, which creates fertile ground for new ideas to emerge. But here's the really interesting part, and it's something that I see all the time in my work with tech companies. The more serious the challenge, the more important play becomes. So let me break this down using my Create the Impossible framework. So if you're familiar with my framework, you know that step 1 is play hard. Now, it does not mean go to Vegas and get drunk. It's not like work hard, play hard. What I mean by play hard is to embrace your inner 4-year-old, to follow your curiosity, to experiment, to explore. When you engage in playful activities, your brain releases neurochemicals like dopamine and endorphins, and they don't just make you feel good, they literally prime your brain for creative thinking. A study from the University of Michigan found that engaging in playful activities can significantly enhance problem-solving skills by unlocking parts of the brain that are often constrained by serious tasks. And additionally, play generally reduces cortisol levels, which is associated with lower stress. Research by a neuroscientist named Sam Wang, PhD, I'm not sure if it's Wang or Wang, found that high amounts of play are associated with low levels of cortisol. And a study published in Art Therapy showed that creative play, such as art making, has been found to reduce cortisol levels. So you want to lower your stress, go make some art, which is one of my favorite ways to play. So step 2 of my Create the Impossible framework is make crap. And here's where this neuroscience gets really cool. When we're in a playful state, the fear center of our brain, the amygdala, lizard brain, sometimes I call it calms down. And that creates space for the prefrontal cortex, which is responsible for creative problem solving, to take over, which of course facilitates creative problem solving. Now, neuroscientist Dr. Stuart Brown, who is the founder of the National Institute for Play, has shown that unstructured, low-stakes play is key to unlocking creative breakthroughs. And this is why serious play, which is an approach championed by Lego Serious Play, which is a methodology, one of the methodologies that I like to use a lot. Serious play is used by organizations worldwide to tackle complex challenges, whether they're using Lego Serious Play or just play that is, strategic. So that's step 2. Step 3 of my Create the Impossible framework is learn fast. Play often induces what neuroscientists call a flow state. You may know what a flow state is. You've probably experienced a flow state. Hopefully you've experienced a flow state more than once in your life. It's that really magical zone where you lose track of time and learning and innovation happen effortlessly. And flow states have been associated with enhanced learning and cognitive processes. When in a flow state, individuals experience intense concentration and higher behavioral efficiency and increased creativity. When we're in flow, we are operating in what Mihai Csikszentmihalyi, I think I'm pronouncing his name right, he's the author of the book Flow, what he calls the optimal experience. And that's where our brain balances challenge and skill to unlock maximum potential. So here's what this looks like in practice. Recently, I led a workshop where a team was really stuck on a complex technical problem. And instead of diving into more analysis, which is where they were really stuck, we played a simple improv game called Yes and. This is using you've probably heard of yes and in the world of improv, to accept and build. And we played a game built around that concept from improv. And within 15 minutes, their brains had shifted from stress mode to innovation mode. And the solution that they had been seeking for weeks just bubbled up and emerged naturally through play. Now, why did this work? Because play isn't just about having fun. It's about creating the optimal neurological conditions for innovation. So here's your challenge for this week. Choose one serious problem that you're facing. It could be at work, it could be, at home. Choose one problem and approach it through play. And maybe that means using Lego to model your system architecture, or maybe it is acting out your user journey with sock puppets or with little gremlin finger puppets. Maybe it's turning your project timeline, there's another alarm, turning your project timeline into a board game. Remember, your brain's most powerful innovation tool might be the one that you left behind. Picture that.
Sorry, no more picturing. Let me put pause. Let's see. Oh, we need to move on to the other one.
I'm what?
Let me stop my thought. Oh, you know what I could have done? I know what I needed to do different.
A room full of
Sorry.
senior
Bear with me.
tech leaders at
I am just playing here, so bear with me. All right. So now you get to go and play. I created something for you guys. I actually said if I'm going to be telling them to go play, I made myself play and found some slides and balloons and try to make it fun. So I'm wondering if you're thinking this, I wonder if if your students are thinking this right now, I wonder if the school nurse is missing me today. I haven't seen her yet, and it's already 12:30. I thought that was pretty funny. I'm sure a lot of our students think that, right? So here's a list of different things that I created with my best friend ChatGPT. I asked it to give us some ideas on things that you guys can do to go out there and play. And some examples were, creating a mini creative break, doodling or coloring, use fun sticky notes. Some of them, 30-minute stretch. It talked about maybe when you're doing any type of note taking or whatever in pencil, just, using fun colors, taking a 10-second, dance movement, maybe when your students are not in the health room, using some maybe nurse humor of the day. That would be kind of fun. I know I'm always up for humor. Something that I actually like to do is what does it say? Game fee your tasks. So how many care plans can I edit before the end of this song? Can I get through this email batch in under 5 minutes? Maybe 5 minutes might not be the ideal. I know right now I've been doing site visits, so I think I'm at 80 right now. 5 minutes will probably not not get me through the 80 emails, but yeah, I'm gonna go ahead and put this in the chat, but I would really encourage you guys to do something today, this next week that you're gonna have some time off. Do something for yourself and go play, regenerate, because I know you guys have a lot going on as I'm going to the site visits. There's a lot of big things going on, a lot of big serious challenges that you're having to do. So, like she said, the more serious the challenge, the more important it is to play. So I would encourage you all to just play. And Lena, I think you have the last slide possibly.
I do, yes. Well, thank you for that reminder to kind of lighten up sometimes. I appreciate that because I know I like to play. I always did the 5-second dance party. One of my favorite things, though, is that some of my frequent friends decided that they would have theme songs. And so if they came in and it was just a silly thing and they knew they didn't need to be there, we had the 5-second dance party to their theme song and then they went back to class. But anyway.
You know what? You gave me a good idea. Why doesn't everybody put on there what's something that you plan on doing that's going to be fun? Put it in the chat while Lena tells you the ending here.
Okay. So just I have displayed the final slide, and it's more for those that watch the recording. So thank you for bearing with us and thanks for sticking with us to the very end. This was a really great meeting today. But we want to thank you for being with us, and we know your time is precious, and so we want to make sure that we fill it with things that are beneficial to you. So if there's anything that you would like to learn about or a presenter that you would like to hear from, please send me an email with their information so I can reach out to them, because I defer to you and what you'd like to hear, because it's not always the Lena show. But so we do offer clock hours for all of these meetings. Your attendance is, if you attend the live meeting, your attendance is being taken. If you watch the recording back, you know that we need to have you fill out the survey form, and that automatically lets us know that you've watched the recording and that you've gotten something out of it. The attendance is going to be tallied over the course of this school year, and so then you will be able to go back into PD Enroller and fill out their survey form for the entire series of the monthly updates back or in May. So hold off for a little bit. You can get your clock hours in the springtime after our last meeting in May. If you have any questions about clock hours at all, please feel free to call me. Well, you can call me. That's totally fine. I might not be able to answer, but a better approach would be to send me an email. So my email is on the slide, and feel free to reach out. We really appreciate the opportunity to see you all and serve you. So thank you for what you do, and thank you for being part of it. Hope you have a wonderful day.
Bye, everybody. Nice to see you, Carrie.
I appreciate your message on play because I think play is underrated.
Right?
Yeah.